We're joined now by Virginia State Health Commissioner Dr. Norman Oliver. He's the state's top health official. Thanks so much for joining us tonight, Doctor. As we wrap up day 2 now of this historic vaccine rollout, how do you feel that it's going so far in your state, and what does this moment mean to you and the people of Virginia?
Things are going really well. We're very excited about the fact that we now have this safe and effective vaccine, and that we're giving it to our healthcare workers and long-term care residents who need it the most. It's going really well. We have distributed the vaccine to 18 healthcare systems around the Commonwealth of Virginia. In a couple weeks, we'll begin distributing the vaccine to nursing homes and assisted living facility residents. We're very excited about it in terms of how it's going, what our reaction is to it. This is the first time we've had something beyond just wearing our masks and washing our hands and maintaining our physical distance to really combat this pandemic.
And obviously this is a massive, complex operation. Do you have concerns at all about potential glitches or even possibly weather delays at this point?
Well, as you may know, we have some bad weather coming our way. We're prepared for that. We've practiced different scenarios, and one of those is having problems with transportation. I think that we'll be okay through this week in terms of the weather. You're right, this is a big challenge. We plan over the next 6 to 8 months to vaccinate millions of people with vaccines that require ultra cold storage, and they have to be given in 2 doses. But we're prepared. We have the people to do it. We have the information systems to keep track of the people that we're vaccinating, make sure that they come back for their 2nd dose. So we're very excited about now having this tool to combat COVID-19.
And your state's vaccines are going first to healthcare workers and long-term care residents. After that, how are you prioritizing other essential workers and groups like teachers, prisoners, veterans, and also the homeless?
All of those groups that you mentioned are among the next cohort of folks that we want to do. It all depends on how much vaccine gets produced, how quickly. We are in the process of trying to develop a list of all of those essential workers in the critical workforce and in those other vulnerable populations you mentioned, such as in correctional facilities. We will, over the next week or so, develop that list and then vet that list with a broad range of stakeholders. Within our vaccine unit, we have an advisory work group that has faith leaders, medical ethicists, scientists, community organizations. We'll let them chime in and help us determine who those essential workers are and in what sort of priority should we be deploying the vaccine and vaccinating those people.
And another vaccine from Moderna could get FDA authorization later this week or over the weekend. Is that also a potential game changer? And how substantially would that speed up your vaccination efforts?
We hope that if the Moderna vaccine is approved later on this week, that we would receive another shipment then of Moderna next week, and are planning, if we get that shipment, to then distribute it to 96 sites across the Commonwealth. The 18 that we distributed the Pfizer vaccine to this week, and many more healthcare systems and local health departments will be receiving the Moderna vaccine. And in addition, we'll get another shipment of the Pfizer vaccine next week as well.
And Dr. Fauci has said that he hopes that 85% of Americans will get vaccinated and that we'll need at least 75% in order to reach herd immunity. Do you think that you'll see that in Virginia? And when do you predict that the vaccine will be available to everyone there who wants it?
We are very confident that we will be able to vaccinate the majority of Virginians with COVID-19 vaccine. In terms of how long it will take, it again depends a lot on how quickly the manufacturers can produce the vaccine. With each phase of this vaccine, we expect to be in that phase for a few months. I would suspect that by mid to late summer of next year, we will have vaccinated the majority of Virginians and be in a situation where we can look towards herd immunity.
And lastly, you've said that it's a priority that Blacks, Latinos, and other high-risk groups get equitable access to the vaccine. What does that look like, and how will you accomplish that goal?
One of the ways that we're doing that is we have really identified where those communities are. And when we get to the point where we are doing mass vaccination sites in local communities, we will make a point of establishing these points of distribution in Black and Latino communities and other marginalized communities throughout the Commonwealth to ensure that they get that vaccine.
Dr. Oliver, thanks so much for your time. We appreciate you talking with us tonight.
Thank you for having me. Appreciate it very much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.